Okay, so I'm basically going to sum up our position on physician-assisted suicide and euthanasia. So we've shown that it's not really necessarily a choice of ending one individual's life anymore. It's more of a societal choice, and that involves more people, and that's why it's not really shouldn't really be considered suicide, because it involves more people's consent than just the individual. So a poll by Gallup showed that doctor-assisted suicide emerges as the most controversial cultural issue in 2011, with Americans divided 45 to 48 over whether it's morally acceptable or morally wrong. So this shows that currently there's not a majority support in the society for this. So that if the legislation were to pass, it's going to be putting a lot of moral consequences on people. And then also within Oregon, there's not that much support for it within the physician community. So Oregon Health Department officials reported in 2009 that in 7 years, from 2001 to 2008, 109 different physicians wrote more than one prescription that resulted in a total of 271 physician-assisted suicide deaths. That's about 1% of the approximately 10,000 active medical physicians in Oregon. Within this 1%, of all Oregon's physicians, there's a high proportion of prescriptions from a small number of physicians. 61% of the 271 lethal prescriptions were written by only 20 physicians, and even more significant is that 23% of the 271 prescriptions only came from 3 doctors. So this shows that there's not a lot of people who really think that this is morally acceptable, and that there's a lot of issue even though it's been implemented, that it's still a problem. And also, it changes the standard of care for physicians. Under the Oregon law, Oregon physicians assisting in suicide are exempt from the ordinary standard of care, skill and diligence required of Oregon physicians in other circumstances. Instead, the physician is immunized from civil and criminal liability for actions taken in good faith in assisting suicide, irrespective of the community standards in other matters, and even when the physicians act negligently. So earlier we discussed some instances of abuse in the Netherlands. And in the Oregon law, it makes it even more of a possibility for abuse, because legally these physicians are not even held accountable for any of their actions, and they don't have to be accountable even in cases where they're shown to be negligent. And so physicians have an important role to play in society as professionals. We give them the authority to practice medicine and provide us with these services, but they have to embody that our interest in our well-being. So it shows that the Oregon law leaves an option for people to for potential abuses. Fabian also talked about palliative care and how it extends life while also reducing the symptoms that maybe would motivate someone for physician-assisted suicide. So in a study of 151 patients with advanced lung cancer, those given early palliative care survived 11.6 months, with nearly 3 months longer than those who received standard medical care. Also, another evidence that may be changing society's view on suicides as a negative and physician-assisted suicide is that Oregon's suicide rate is higher than the national average. So, in an article in the Oregonian magazine, Oregon's suicide rate is 35% higher than the national average. The rate is 15.2 suicides per 1,000 people, compared to the national average of 11.3 per 100,000. So this doesn't necessarily say that this is a direct cause of it, but it's just showing that Oregon is one of the 3 states in America that have legalized physician-assisted suicide, and their suicide rate is 35% higher than the national average. So by changing the silo's view on the value of human life, it maybe leads to more long-reaching implications.